Good evening to all the viewers and participants. My name is Madhuri Mishra. I am a student at the Yogaguru Institute doing a 200 hours teacher training course and also pursuing MA in yoga. Welcome to this session being conducted by the Yoga Research Study Circle, which is a part of the Women Health Research Foundation, also called as WHRF. Our study circle is a team that helps yoga professionals publish their research and get their work recognized. We invite achievers from different fields every Sunday to share their experiences and inspire others. Today, we have Palka Bhasin Kapoor, who is a qualified clinical psychologist and a special educator. She has been practicing for over 17 years as a mental health expert and nutrition advisor in various hospitals like Escorts, Fortis, Apollo, and schools as well. She runs a mental health platform named Dump.it and provides online and offline sessions and consultations. Palka's forte lies not only in counseling, but providing the client with right therapy, lifestyle modifications, which helps the client in holistic recovery from mental health issues. She will be speaking today on what is therapy and importance of therapy in mental health. Over to you, Palka.
Thank you so much, Madhuri ji, for this beautiful introduction. I am so humbled with this beautiful platform, WHRF. And this platform is such a beautiful platform because there is exchange of information on vital topics. So much exchange of energy and information happens with every new individual and an expert. I'm humbled and thank you so much for the love and recognition that I have always got from this platform. So today I will be talking about what is therapy, importance of therapy, and mental health. So I'd like to share my screen with all of you. So as the topic says, mental health. If you want to know more about mental health, you can log on to this website, www.dumpito.com. It is a comprehensive website, very easy to understand, simple English language, which will give you detailed information on mental health, what is mental health, and what you can do if you are going through something on mental health issues, or if somebody close and near and dear one is going through, how to deal and help the person. So we will start today by knowing that what is mental health. See, we all have a mind, like we have a physical body, we also have a mind. So if we have a mind, we have a mental health like our physical health. So whenever there is an error in our thought process, our behavior changes in our present situation and our circumstances. So for example, our behavior is anger, depression, anxiety, चिड़चिड़ापन, mood swings रहना, या फिर lack of interest, no joy of living, एक बस रोजमर्रा की जिंदगी हम काट रहे हैं. We are not sure of ourselves, of our achievements. Even in our relationships, we are not giving 100%, or we feel that we are not getting back 100% from our relationships. If we are at a job, we feel that we are not deserving, or we feel that people don't, take us and our importance, and we are just a puppet over there. So, we get lost in these things, and thus people can see it in our behavior. This person was social, is not social. This person is getting angry very frequently. या घर में हम बच्चों के ऊपर snap करने लगते हैं, या फिर हम हमारे social interactions reduce हो जाते हैं. ये क्यों होता है? Because these behaviors are seen either by ourselves or others, but before behavior, there is a feeling, and before feeling, there is a thought. So whenever there is an error in our thought process, which happens over a period of time, it does not happen immediately. It happens over a period of time through an event or circumstances in one's life. It leads to these faulty or unhealthy behaviors, and thus our mental health starts to deteriorate or starts getting affected. So this is what mental health is. When there's an error in a thought process from the rational, when we start thinking irrationally, negative, unwanted thoughts, overthinking, lack of appetite, or eating more, not sleeping well. When we get up in the morning, we feel lethargic and lazy. So we know our mental health is now deteriorating. So this was what is mental health. This was how I would like to tell you that this is mental health. And ये देखिए, ये इतना सुंदर एक पिक्टोरियल रिप्रेजेंटेशन है, डायग्रामेटिक रिप्रेजेंटेशन है मेंटल हेल्थ के बारे में, कि जब हमारे मेंटल हेल्थ में या हमारे थॉट प्रोसेस में कोई एरर आ जाता है ड्यू टू सर्टेन सिचुएशंस एंड सर्कमस्टेंसेस, तो जो हमारी थॉट्स हैं, जो हमारी फीलिंग्स हैं, जो हमारे इमोशंस हैं, जो हमारे बिहेवियर हैं, वो देखिए कैसे मडल्ड अप हो जाते हैं। जो हम नहीं बोलना चाहते हैं वो बोल देते हैं, जिस तरह से नहीं बिहेव करना चाहते उस तरह से बिहेव करते हैं, जिस तरह से हम जीना चाहते हैं उस तरह से जी नहीं रहे हैं. सो देयर इज अ लॉट ऑफ मडलिंग ऑफ आवर feelings, emotions and behavior in our mind. But when we go through this beautiful process of therapy is a process. Okay, I would like to tell everybody that therapy is a process where you invest your time, and through that beautiful process of therapy, see how you rewire your brain, rewire your feelings, rewire your thoughts, rewire your behavior, जिसको न्यूरोप्लास्टिसिटी भी कहते हैं, जो एक थेरेपिस्ट आपको हेल्प कराती हैं इस लेवल पे लाने के लिए. So then you start thinking, feeling and behaving in a much more synchronized manner. So and also see, we cannot see mental health. जब ये deteriorate होती है over a period of time, हम इसको देख नहीं सकते. We can only feel it. People can feel it in our behavior, or we can feel it in our behavior everyday life. कि I was not like this before, लेकिन अब मैं ऐसी हो गई हूँ. या मेरे ये life के goals नहीं थे, लेकिन मैं किस तरह की life जी रही हूँ. So we can only feel these things. We cannot see it. We feel it from inside, but we may or may not be able to communicate it to other person, or the people who are near and dear to us, they may or may not understand what we are trying to tell them. So we can only feel mental health. Now, some of the common things with people, when I ask them that what are your present concerns, why have you come to me, what are your present concerns, तो जो बहुत common आजकल prevalent concerns हैं, जो मुझे simple layman language में लोग बताते हैं, और ये it is not only happening with adults, it is happening right from children to teenagers, adolescents to young adults to middle-aged population to geriatric population. तो ये जो चीजें मुझे लोग बताते हैं, वो कहते हैं we can't sleep at night. हमें रात को नींद नहीं आती है, क्योंकि बहुत टाइम से नींद नहीं आ रही है, स्लीप साइकिल डिस्टर्ब रहता है. तो जैसे जैसे शाम ढलती है वैसे वैसे दे फियर कि क्या आज रात को नींद आएगी या आज रात को भी नींद नहीं आएगी. सो दिस फियर ऑफ अनसर्टेनिटी स्टार्ट्स टू बिल्ड अप, एंड दे स्टार्ट फियरिंग स्लीप एंड नाइट. दैट लीड्स टू डिस्टर्ब स्लीप साइकिल. और आई गेट वेरी नर्वस वेरी क्विकली. कोई भी सिचुएशन या सर्कमस्टांसेस होते हैं, दे गेट नर्वस. They don't know how to respond and react. They don't know how to deal with the situation. They start doubting themselves. So nervousness आती है लोगों में. Other symptom which people tell me or their present concern is my heart races very fast in situations where I am not comfortable. अगर वो ऐसी situation में है जहाँ they are unable to communicate or express themselves, their heart starts to pump, starts to beat very fast. They don't know whether they're having a heart attack or they're having a panic attack, or why is this heartbeat happening. किसी ऑफिस की मीटिंग में, या बच्चे की स्कूल में पीटीए में जाना है, या मदर इन लॉ घर आ रही है, या हस्बैंड को घर आ रहे हैं ऑफिस के बाद. कोई भी सिचुएशन जिसमें वो अनकंफर्टेबल हो, चाहे मेल या फीमेल या छोटा बच्चा जो वो एक्सप्रेस नहीं कर पा रहा, so कहते हैं our heart starts to beat very fast. I can't take decisions. इतना सेल्फ डाउट होने लगता है, छोटे छोटे डिसीजंस हम नहीं बना पाते हैं. खाने में क्या बनाऊं, रेस्टोरेंट जाते हैं तो अगर हम ऑर्डर दे रहे हैं वो भी 2 बार पूछेंगे किसी और से, तुम बता दो. अगर कुछ कपड़े पहन रहे हैं, वी डाउट हाउ आर वी लुकिंग, so we will ask 10 people. We are just not sure about what we are doing. अगर हमने अपना कमरा किसी particular way से सजाया है, we would want opinions and suggestions from others because there is so much self doubt. Sleep does not come to me easily. तो नींद नहीं आना रात को. I am not good enough. I don't deserve this. This is known as the imposter syndrome, जो आजकल बहुत लोगों को हो रहा है, that I am not good enough. अगर मुझे एक अच्छा घर मिला है, अच्छी जॉब मिली है, इंजीनियरिंग क्रैक कर लिया है, मेडिकल कॉलेज में पहुंच गए हैं, they start failing from there. After doing so much of hard work, they feel that we don't deserve. I am in the wrong place. I have taken someone else's place. और फिर वो क्या करते हैं? They start proving to themselves or to others around them. They prove so much that they get tired and they need validation all the time. अगर उनको कोई validate नहीं कर रहा, उनको validation नहीं मिल रहा, they feel uncomfortable and lack of confidence. ये बहुत हो रहा है लोगों में. I need to compensate for the things that others are providing me. कि हमारे पेरेंट्स ने हमें बड़ी मुश्किल से बड़ा किया है, इसलिए वी कांट से नो टू देम. या मेरे हस्बैंड इतना मेहनत करते हैं, आई कांट से नो टू देम. या मेरे इन लॉज ने मुझे अपने घर में रखा हुआ बेटी बना के. इवन दे आर अनकंफर्टेबल, इवन इफ दे नो थिंग्स आर नॉट राइट, इवन इफ दे नो दैट दिस present situation is something they need to speak up, they keep compensating. अपनी स्लीप को रिस्क पे रखते हो, अपनी हेल्थ को, अपने व्यूज को, अपनी फीलिंग्स को. they keep compensating कि they are doing so much for us, they are doing, without realizing that you are deserving. So these thoughts are all irrational thoughts. These thoughts are all coming out of uncertainty, fear, unknown. These are irrational thoughts which definitely lead to mental health issues. Also, I am exhausted by overthinking. इतने सारे questions pop out होते हैं दिमाग में एक ही टाइम पे. इतनी ज्यादा thinking हो रही होती है about topics which are not even important. छोटी छोटी चीजें बार बार overthink कर रहे हैं, बार बार उसकी चीज के बारे में बोले जा रहे हैं, एक ही सिचुएशन के बारे में सोच सोच के घबरा रहे हैं, जबकि वो हुआ भी नहीं होता अभी. It's not occurred yet in the present, but we are going in the future and we are already reaching. अगर A होगा तो मैं ऐसा करूंगी, B होगा तो ऐसा करूंगी, C होगा तो मैं ऐसा करूंगा, D होगा तो ऐसा करूंगा. And it is exhausting them. I feel underconfident. Confidence goes for a toss. We are not sure of ourselves, what we are doing, what we are speaking, how we are behaving. I get nervous very quickly. I am unable to communicate. So when we have these irrational thoughts, जहाँ हमारी thoughts effect होती हैं, जहाँ derailment शुरू होता है, तो हमारा जो communication है, चाहे English में बोल रहे हो, हिंदी में बोल रहे हो, they are unable to communicate. There's a balance in communication, passiveness and aggression. हम इसमें झूलते रहते हैं, या तो हम बहुत passive बन जाते हैं कि we treat ourselves or we let other people treat us like a doormat, and we, because of lack of confidence and self-esteem, हम सुनते रहते हैं, और we become very assertive. कि जब बोलते हैं तो इतना ऊंचा चिल्ला के बोलते हैं कि पूरा घर का माहौल खराब हो जाए या ऑफिस का माहौल खराब हो जाए, या हम अगर सोशल गैदरिंग में people don't want to interact with. So जो बैलेंस है वो खराब हो जाता है, जो एंजाइटी से आ रहा है क्योंकि we have a poor mental health. It's very important to be assertive. And this will only come through therapy. So I'm unable to communicate. हम बता ही नहीं पाते हैं हमें दुख किस चीज का या दर्द क्या है. Is it a big thing? Is it a small thing? Should I speak about it? Is it relevant? We are in that spiral of validation. I'm exhausted by negative and unwanted thoughts. I'm unable to, think properly. I can't say no. We are not able to set boundaries. हम boundaries setting नहीं कर पाते. हम no नहीं बोल पाते. We start feeling guilty because we feel we need to compensate. We don't deserve this. So we forget what are healthy boundaries for our well-being, for the well-being of a good relationship, for our home environment, for our work environment, for our finances, for anything. We are unable to say no. We start feeling guilty and we take up more than what is required. I feel tired and mentally exhausted. ना एक जो बहुत कॉमन है, चाहे कोई भी डायग्नोसिस हो, एक जो बहुत कॉमन चीज है वो है एंजाइटी. अब एंजाइटी कैन हैपन इन एनी फॉर्म. एंजाइटी कैन हैपन इन एनी फॉर्म. इट कैन हैपन इन फिजिकल फॉर्म, it can happen in emotional form, it can have physiological things like heart beating very fast, or emotionally when we are disturbed, or anxiety के बहुत forms होते हैं. And Our mind, our mental health and physical body, or mental body and mental health are related to each other. They are not separate. सो आजकल जैसे ये पीसीओडी, पीसीओएस, ऑटो इम्यून डिसऑर्डर, यूरिनरी ट्रैक्ट infection is on a rise, and one thing common in this is anxiety. So if you are suffering from these things recurrently and you are going to doctors, they give you medication which symptomatically reduces the symptoms to give you relief. But because of repressed feelings and repressed emotions which you are not able to communicate, ये जब भी कोई stressful situation होती है ये snowball करता है. चाहे आप फिर हार्मोन थेरेपी करा लें या फिर ऑर्गन कोई हटवा दे अपने यूट्रस को या थायराइड ग्लैंड को निकलवा दें, बट वन थिंग कॉमन इज एंजाइटी इन all of them have underlying stress and underlying anxiety, जो एक medical practitioner भी बोलते हैं reduce it. But because we don't know how to reduce it, where to go, whom to talk, even is this thing that we are going through, is it worth talking? Because we are not aware of it, that help is available. So we keep suffering with these lifestyle related issues. So our mental well-being and our physical body are connected and interconnected with each other. They are not separate from each other. And one thing is कि जो इनके diagnosis होते हैं या symptoms होते हैं, PCOD, PCOS, autoimmune disorder या urinary tract infection की, there is no specific diagnosis. Everybody is going through a different issue, a different kind of pain, different kind of PCOS issue. किसी का weight gain हो रहा है, किसी का weight loss हो रहा है, किसी का thyroid बढ़ा हुआ है, किसी का low है. So there is no specific diagnosis. Also, since symptom varies from individual to individuals because of several reasons, there are no common symptoms and they keep varying according to situations and circumstances. When you are in a good mood, it is suppressed. When situations and circumstances are not according to you, they get enhanced. Stress, जो एक तनाव है आपकी लाइफ में, low immunity, maybe lack of vitamin D3, B12, no immunity of the body, mood swings. In सब में एक चीज common है, the mood is never stable. It is always up and down, up and down. There are so many highs and lows that you are not able to cope up with your own moods. आपको अपने mood swing से डर लगता है, या जो आपके आसपास लोग रहते हैं उनको नहीं पता ये कब snap कर जाएंगे, या कब इतने irritable हो जाएंगे, या कब frustrated हो जाएंगे, body language change हो जाएगा. So the mood is very, very unstable, which may lead to, binge eating, stress eating, and other issues. Lack of vitamins and minerals, definitely. Lifestyle, your lifestyle is a very unhealthy lifestyle that you're leading because your sleep cycle may not be proper. There is more screen time. Maybe your cortisol level is high, that is the stress hormone. And maybe, the diet that you're eating is not a serotonin producing diet. It does not calm you. So lifestyle में बहुत सारी चीजें आती हैं. And of course, anxiety. What is anxiety? Overthinking, trying to control things around you, or knowingly or unknowingly, or you feel others are trying to control you knowingly or unknowingly. It could be both. Either you want to control something in your life which you are unable to control, or you feel that other people are trying to control me, my feelings, the way I want to live life. So you are in that suppress and repress situation where you are not able to vent, you're not able to express. और अभी आप ये देखें तो इन सब में डॉक्टर के तो आप जाते ही हैं, बहुत कुछ कराते हैं, बट सी थेरेपी कैन हेल्प यू इन many ways. There is lot of awareness on mental health, but there is not awareness on how therapy can help. जो मेंटल हेल्थ के बारे में अभी भी लोग सोचते हैं वो है कि हम एक थेरेपिस्ट से जाके बात कर लेते हैं, मन हल्का कर लेते हैं, बट नो, थेरेपी इज बियॉन्ड दैट. A professional who is well qualified and who knows the field and is from a qualified field of psychology can help you in a much more better manner, because he or she will help you to differentiate between rational and irrational thoughts. Because our thoughts need to be rational, like I said. Your thoughts lead to your behavior. So over a period of time, there is deterioration. Our circumstances and situations lead to this deterioration. So a psychologist will help you, or a therapist will help you to differentiate between irrational and rational thoughts in a very much better manner, where she can psychoeducate you. Differentiate between fear and danger. कि जिस जो हमारी thoughts हैं या जो हमारी रोज की जिंदगी है, are we leading out of fear, uncertainty, unknown? Where are we operating out of? Where is our thought process operating out of? Or out of danger? See, danger is real. What is dangerous for Palka is dangerous for you. And what is dangerous for you is dangerous for Palka, because danger is real. जैसे coronavirus, it was real. It is dangerous. सबके लिए dangerous है. But fear is something created by the mind. So जब we become irrational, that means we are operating out of fear, uncertainty, unknown. So the psychologist or a therapist will help you with these, thought processes. Work on things like things I can control versus things I can't control. अगर आप ये beautiful diagrammatic presentation देखेंगे, तो यहाँ पे दो चीजें, there's an inner circle and there is an outer circle. So the inner circle says things I can control. So the things that are in the inner circle, like the responses to others' behavior, how I speak to treat others, where I give my time, energy, attention, when and if I forgive others, the boundaries are set with others. These are all in your control, how you want to do it, when you want to do it. But the outer circle, that is what others think of me, what others say, what happens around me, the attitude of others, the beliefs, perceptions of others, the past, the future, the boundaries of others, and the other things are on the outer circle. They are not in your control, and they are situational and circumstantial. Unfortunately, 99.9% we are on the outer circle because of our social conditioning. We are trying to please people, we try to appease them, because that is the social conditioning that all human beings have been used to. Our social environment, our social upbringing, because हम एक समाज में रहते हैं, एक व्यवहार करना है, but there is we don't focus on ourselves, what we want, and that circle keeps on changes, hence you keep getting anxious. जो आज सही है वो कल गलत हो जाता है, और जो कल गलत था वो आज सही हो जाता है, because it is all situational and circumstantial. So our focus through therapy is the inner circle, not the outer circle, because we can't control it. Also focus on sleep hygiene. Sleep is such an important part of our mental well-being. And over the years, the quality and quantity of sleep has deteriorated for everybody, from children to adolescents, to young adults, to middle-aged people, to geriatric population. The quality and quantity of sleep has really deteriorating over a period of time, and that affects our well-being, our mood. We feel tired, we feel exhausted, and this also contributes to our poor mental health. Have a neutral perspective on things. Therapy helps you to have a more neutral perspective, a balanced perspective, like neither to be passive nor to be aggressive. How to acquire assertiveness, and that is through the neutral perspective. Lifestyle modifications. Lifestyle modification is so important because all these things help in a very holistic approach. Therapy is not only focused on your mind, it focuses on holistic approach. So in our lifestyle modifications, therapy, because it is a process, we tailorize and customize the session according to the client's need, so that they are able to do the lifestyle modifications in their comfort zone. So lifestyle modification may be focused on a good routine, maybe a walk, gym, yoga, Pilates, mindfulness, how it contributes to a good mental well-being, mood and food. See, it is very very important. आजकल तो हर जगह इतना information है कि जिस तरह से हम खा रहे हैं, जो हम खा रहे हैं, how it affects our mood. You know, so what we are eating is very very important. And are we binge eating? Are we junk eating? Are we stress eating? Um, all these things contribute to your mental well-being and health. So mood and food, a good serotonin producing diet is very very essential for a good mental health and also for your gut health. When your gut health is good, mental health axis and gut health axis are connected to each other. So it's very important to have a good health, and lifestyle modification techniques focuses on a good gut health. Also, decision making strategies are very important. When we do not make decisions in our life, we are always swinging like a pendulum, or we feel like a ball in a rattle. We feel like a ball in a rattle. Anything that happens in the outer circle, we get perturbed. We start fearing, we start overthinking. There is negative thinking. So, therapy can equip you with coping mechanisms and techniques during stressful situations. We give you and we empower you with those techniques and those strategies that you can use lifelong in any stressful event in your life. So therapy can help in all these things, and it's very very helpful. There are different kinds of therapies. Therapy is just not talk therapy. There are different therapies, and let me tell you about them. The number one therapy is CBT, that is cognitive behavioral therapy, which is used widely all over the world, and it's very effective in most of the situations like anxiety, depression, grief, relationship handling. It is very very effective. Then there is REBT, that is rational emotive behavioral therapy, which is very very powerful and equally effective. So when you go to a therapist and she makes a diagnosis, she will be able to know what kind of a therapy the client needs, or what kind of therapy is happening, or what kind of therapy is needed. So as a client, it's very important that you are aware कि आपने कौन सी therapy ली है. मेरे पास बहुत सारे clients आते हैं और वो बोलते हैं हमारे previous भी हम psychologist के पास गए हैं, हमने sessions लिए. But when I ask them, what did you do? Which kind of therapy were you following? They are unaware. They don't know कि उन्होंने क्या किया. They are unable to tell. So they keep feeling the same way and they keep spiraling. So it's important to know what kind of a therapy program your therapist is working on. There is art therapy. There is eclectic approach, where the therapist feels that she needs to take the best of all therapies and give you an eclectic approach. Of course, there is hypnotherapy. There is focus solution therapy, need-based therapy, and transactional analysis. So according to the diagnosis, according to the need of the client, according to his present concerns, the psychologist can choose and give one of these therapies or a combination for a long and healthy, well-being of the client. Why therapy is important at Dumpit? See, there are a lot of mental health platforms available these days, and there are a lot of psychologists and counselors available. But it's very important that you go to the right person at the right time, the right platform at the right time. And why therapy at Dumpito? Because Dumpito has an experience of 45 years. The team of Dumpito is a very, very experienced team. So we have a lot of experience. Also, because we have not only catered to Asians in India, we have catered to globally, we have catered to our clients. So we know how to, irrespective of race, nationality, sex, creed, caste, we have the vision and we have the knowledge how to lead to diagnosis and what kind of therapy. We have that vast experience. Also, we not only work with individuals, we work with couples, we do family therapy, we work from small individuals to big corporates and hospitals to schools. So, the kind of exposure that our platform has and the kind of knowledge that we have gathered over the years and the kind of diagnosis and the problems that we have worked, so we can provide a much more much more comprehensive therapy to our clients, to the person who needs diagnosis or who needs help. Firstly, our sessions are confidential. So these sessions are extremely confidential. There is a clause of confidentiality that is maintained, non-judgmental. You could be a single mother, you could be a divorcee, you could be a gay, lesbian, pansexual, bisexual, heterosexual, metrosexual, straight, live-in relationship, separated, anything. We don't judge you, what you have done or where you are coming from. We don't judge you. We accept you as a person who you are, as a whole person. Your actions and your behaviors do not make you. So we don't judge you. This platform does not judge you. The therapists on these platforms don't judge you. They accept you the way you are. It is a safe space and a neutral environment because of confidentiality and non-judgmental clauses. At Dumpito, we don't give suggestions or make decisions for you. See, therapy is not hand-holding you and making your decision or giving you suggestions. Because what may be correct for me may not be correct for you, the same decision in the same situation and circumstances. Because we all are individuals, right? And we are different individuals. We have a different mind and we have a different thought process. So we enable you, handhold you, psychoeducate you so that you can make your own rational and informed decisions according to your situations and your circumstances. Professionally qualified individuals with at least a master's degree in psychology. So all our therapists have at least a master's degree with a lot of research work. So they are qualified, leads to correct diagnosis. We do history taking. There is a proper way of history taking and diagnosis before we give any kind of diagnosis, or we reach to any kind of result, or we focus on anything. So there is a proper diagnosis. Focus on solution oriented, result focused solution and therapy. We always focus on solution oriented. We always focus on how to reach our goal in a more better manner and not focus on the problems. Because if you focus on problems, then there will always be hurdles. But when we are focusing on our solution, we will definitely reach our goal. Psychoeducation, which is such an important part of our therapy. We psychoeducate our clients because at Dumpito, we don't want them to be independent on their therapist. Ultimately, it is your life and you have to lead it independently. So with psychoeducation, with the correct learning program, the correct techniques, the coping mechanisms and strategies which we share with you over the sessions, we email you, we send them to you on your WhatsApp. You can use that information during any event or a stressful situation. It is going to be with you for the rest of your life. Aisa nahi hai that you're going to be dependent on your therapist or your psychologist. So we equip you for lifetime challenges. We introduce you to your feelings, thoughts, and emotions so that you on your own know that am I thinking rationally or am I thinking irrationally? Am I thinking out of fear or is it danger? Because if it is danger, everybody would be shouting. If it is danger, everybody would be panicking. But we introduce you to your feelings so that you can make informed decisions and behave accordingly. We also equip you, we give you psychoeducation, how your brain is functioning, the lower brain and the upper brain, in which situation your parasympathetic nervous system gets activated. What can you do about it? So all those mechanisms and scoping strategies are shared with you over the sessions, and therapy helps you to focus on self-love and self-awareness. Again, focus on ourselves. The kind of life we start, living, jo rozmarra ki zindagi hoti hai, whether it's a man or a woman, we get lost in the needs of others, pleasing of others, fulfillment of work, responsibilities. We forget ourselves. तो जब हम अपने आप को importance नहीं दे पा रहे, do you think we can focus good on our relationships? No. Do you think you can give good to your family environment? No. Do you think you can contribute effectively to your work? No. So we start with this feeling of, we teach you how to love yourself and have awareness about it without feeling guilty. Without feeling guilty, जो हमें लोग अक्सर करवाते हैं, अरे you are focusing on yourself, you only think about yourself, and we start feeling guilty about it. So we help you, we psychoeducate you. So there are a lot of myths about therapy. Usually people feel therapy is like, you're talking to a friend, या आप अपने घर में किसी बुजुर्ग से बात कर लें, या किसी ने लाइफ में बहुत ज्यादा अचीव किया है तो उनसे उनका ओपिनियन और सजेशन ले लें. बट जैसे मैंने कहा, एवरीबडी हैज अ डिफरेंट लाइफ एंड द सेम solution may not work for other people, maybe in the same circumstances, because we all are individuals. So what therapy is not? It is not a waste of time. It is investment of time. If you don't come for therapy today, or if you don't invest your time from your busy schedule to therapy today, you might have to pay long-term cost for it. Long-term cost in terms of your relationships, in terms of your health, in terms of your well-being, in terms of your jobs, in terms of your mental peace and well-being. You will always be irritated. You will always have a poor gut health. You will always be overthinking. You will always have negative thoughts. Even if good things are happening to you in life, you will always do mental filter, that is unhelpful thinking ways. You will always think in the ways which make you unhappy. And you will always be in a zone where you are either trying to prove yourself or prove others your worth. Waste of money. सिर्फ बात करने के लिए they are going to charge you. अरे मेरे से बात कर लो, मम्मी से बात कर लो, पापा से बात कर लो, या अपने फ्रेंड से बात कर लो. It's not a waste of money, friends. I would like to tell you, it's investment. Because today, if you don't take care of your PCOD, PCOS, which is happening because of stress, there can be bigger issues in life. You are paying a short-term cost for it right now, and you are going to get long-term benefits. But if you don't pay this cost today, you don't get into therapy today, you are going to pay long-term cost with short-term benefits. So it's going to reverse. So therapy helps you from this decision-making, so that you know the difference between instant gratification, जो हमें जल्दी से मिल जाती हैं, and how to have long-term benefits when we make well-informed decision. So it's not a waste of time and money. It's an investment in your well-being, in your mental health, in your relationships, in your job, in your life, and your peace of mind. Also, it's beyond just talking, venting, and catharsis, because we do equip you with psychoeducation. And those tools are given to you, which a professional can give. Therapy does not focus on your past experiences and belief system. Like, therapy is not judgment. So, whatever has happened in the past, or whatever social conditioning have been in the past, it may or may not have any, effect on your present. And this is what neuroplasticity, through neuroplasticity and through rewiring your thought process, we make you focus on your present. Because when we go back in the past or focus too much in the future, we are always swinging like a pendulum. So we make you focus on your present to make it much more beautiful and meaningful. Therapy is not like speaking or talking to friends, relatives, or elders at home, because they will always judge you. They will always going to give their experiences and suggestions, which may or may not have any relevance in your life. They are always going to tell from their past experience and belief system, which may or may not have any relevance in your life. And when you hear that over and over again, it may lead to unwanted thoughts, irrational thought process, anxiety, depression, mood swings. So here you are talking to a therapist who is a neutral person, who does not judge you. Everything is extremely confidential, and the therapist helps you to make informed decisions, in which you start feeling better in your everyday life, dealing with issues in an effective manner. So at Dempito, we help you to get your peace of mind. It helps you with that hope that somebody is available if you reach out to us. If you are going through certain, feelings that you're not sure of, or if you are going through certain emotional turmoil, feel free to reach out. This is the right platform to reach out for your well-being, for your mental health, and for people around you. So this is where there is light, there is hope, we get peace, and we help you through this process. We handhold you through this process till the time you don't start feeling better about yourself. And you can read our reviews on our website. When we read reviews of people, how they have benefited from therapy, our confidence in therapy increases. We know that it is meaningful. This investment is going to be better for me in the future. This is a good investment. So that will help you and all of us to move further towards our well-being, our mental health, not only for ourselves, but people around us. I hope this information was useful to every one of you. If you have any more questions related to therapy, or you want to ask in which situations we need therapy, or if I'm ready for therapy, you can ask me on this platform. If you want to know anything more, feel free to ask me.
Yep, thank you, Palka. बहुत ही informative session था, and there were some great pointers about mental health and all. तो मैं आपसे कुछ questions पूछना चाहूंगी for the benefit of our viewers. So सबसे पहला क्वेश्चन है कि आपके पास टिपिकली किस तरीके के क्वेरीज आते हैं, किस तरीके के इश्यूज लोग लेके आते हैं थेरेपी या काउंसलिंग के लिए?
So usually जो हमारे पास आजकल जो hot issues आ रहे हैं, we are in 2023, and हम COVID के बाद, people have started focusing on themselves, that these are real issues. Organizations have started, investing in mental health, not only in vending machines, but in mental health also. So बहुत ज़्यादा जो आ रहे हैं वो होते हैं जो I'll start from common to, the more complex ones. Anxiety, depression, mood swings, suicidal thoughts, grief, loss of a loved one or loss of a job, or how do I manage myself at my workplace? I feel my communication skills are not good, hence I feel I am underconfident, lack of self-esteem, imposter syndrome, I'm not worthy, I don't deserve this. Couple issues. Whether you are in a live-in, whether it's an arranged marriage, whether it's a love marriage, बहुत सारे couple issues आ रहे हैं where people are not understanding how to live a life on a daily basis together. So there are frequent fights, family interference हो रही है, trust issues आ रहे हैं, trust issues का respect issues आ रहे हैं, my partner does not respect me, या फिर financial clarity नहीं है. So ये सब चीजें आ रही हैं couples के बीच में बहुत ज्यादा. कम्युनिकेशन स्किल्स, एम्प्टीनेस सिंड्रोम, जब बच्चे बड़े हो जाते हैं या मदरहुड का काम खत्म हो जाता है कि बच्चे बड़े हो गए, कॉलेज चले गए, तो अब कुछ करने को नहीं है, एम्प्टीनेस सिंड्रोम, व्हाट शुड आई डू? बच्चे 11वीं में पहुंच गए या कॉलेज चले गए, अब द वुमन ऑफ द हाउस हैज नो वर्क, क्योंकि उसकी लाइफ पहले क्या थी, आउटर सर्कल में घूम रही थी, बच्चों के आसपास, हस्बैंड के आसपास, इन लॉज के आसपास. अब बच्चे बड़े हो गए, वो चले गए, हस्बैंड ऑफिस चले जाते हैं, अब खालीपन है. You don't know how to deal with that emptiness syndrome. Lifestyle related issues, जैसे मैंने कहा आजकल health related issues हो रहे, conceiving issues, abortions, IVF, not able to conceive, या फिर postpartum depression, postpartum anxiety, high risk pregnancy जो बहुत ज्यादा हो रही है. How to deal as a couple, कि उसमें couple involved होता है, family involved होती है, तो बहुत ज्यादा stress हो जाता है हर चीज को लेके. When you feel there is brain fog or body fog, when your brain wants to shut down, where you're working, procrastination, that I want to do so many things in life, but I'm unable to do. मुझसे होता नहीं, मुझे करना है. Motherhood issues, that should I job versus motherhood? Should I focus on my job or should I take motherhood? What decision should I take? Anger issues, substance abuse, smoking, tobacco, unhealthy behavior, illicit relationships, where you are already in a healthy relationship, but when you get anxiety and depressed, you start doing unhealthy behavior knowingly कि ये गलत है, लेकिन हम वो कर लेते हैं. talking to the opposite sex in not an appropriate manner. हमें मालूम है कि ये गलत है, but जब हमें anxiety होती है, stress होता है, या when situations are not good at home, we start resorting to these things where we feel कि हमें comfort मिलेगा, where we will be acknowledged, self doubt. तो ये कुछ issues हैं जो आजकल बहुत ज्यादा rise पे हैं. Also gender, what gender do I, what my identity, sexual identity. So people are confused, they are not okay, or if they are okay, they feel our family is not okay. So acceptance milega nahi milega. So all these issues are there, and सबसे ज्यादा है anxiety and fear, uncertainty, which is killing. अभी कुछ हुआ भी नहीं होता है, and people just start thinking, and their body starts responded to it. They feel they're having a heart attack, but it's a panic attack, and it's like an everyday process with them. So ये कुछ hot topics हैं जो आजकल बहुत ज्यादा लोग present concerns के साथ आ रहे हैं.
ओके, सो जैसे ये लोग थेरेपी सेशंस के लिए आते हैं अपने इश्यूज के को लेके, तो आपको क्या लगता है, मतलब उनसे कैसा फीडबैक आपको मिलता है? डू दे रिकवर, आर दे लीडिंग हेल्दी लाइव्स, आर देयर इश्यूज रिजॉल्व्ड? तो मतलब उनका स्टेटस क्या रहता है? आर दे क्योर्ड?
Yeah, so jaisa puche, are they cured? So like I said, therapy is a process, but the way we do therapy at Dumpito, we can हम अपने therapy को एक data में डाल सकते हैं, from where they started and how they are now. How you were feeling and how you were behaving when you came to the therapist, and how you are feeling and how you are behaving now. Were your thoughts irrational from how you have reached to the rational zone? The way we help with psychoeducation and the way we help through therapy, you can actually see your progress on your own. So you can know how well you are feeling, how well you are doing, how confident you are feeling now, how beautiful your relationships are now as compared to when you came for therapy. So we can actually chart it. We can chart it beautifully, and there are ways of charting. There are techniques which definitely we share with our clients. कि अगर आप इसको maintain करें रोज date wise, you can see your own progress. You can see first session, then the second session, then the second session, then the third session, how you have transformed your life or your symptom. When you came, it was severe, and now it's moderate, or it's very less, mild, moderate, severe. So they can see themselves. Apart from that, the reviews, like I said, how will we come to know, how will we feel, or what will happen? The best way is to read the reviews of people. They are real people, just like you and me. Somebody can be a doctor, lawyer, engineer, housewife, teenager, retired people, people in the police force. There are people from different backgrounds. So, when you read about them, you come to know about the issues, and you come to know how they have healed and how therapy has helped people, heterogeneous people across the population. So it is not restricted to middle class, upper middle class. Therapy is for everybody, boy, girl, man, woman, child, old people. It is for everybody.
Okay, so one last question before we go. मतलब आपके हिसाब से, according to you, at what stage should a person be? मतलब कब उनको ये लगता है, या कब वो आइडेंटिफाई करते हैं कि हाँ, अब मुझे थेरेपी की जरूरत है और अब मुझे आपके पास आना चाहिए काउंसलिंग या अपने थेरेपी के लिए?
So see, sometimes people come on their own, and sometimes other people recommend therapy. जैसे मैंने कहा, therapy can only be felt. It cannot be, mental health can only be felt. It cannot be seen. है ना? तो हम सिर्फ फील करते हैं, या तो आपके आसपास लोग महसूस कर रहे हो कि इनका बिहेवियर ठीक नहीं है, शी गेट्स लॉस्ट और ही गेट्स लॉस्ट, इनका सोशल इंटरेक्शन कम हो गया है, लाइफ में इंटरेस्ट कम हो गया है, या ये वर्क में इतना इंटरेस्ट नहीं ले रहे हैं, या इनकी हेल्थ खराब हो रही है, इनका ब्लड प्रेशर बहुत बढ़ रहा है, या इनका अगर आर्थराइटिस है तो पेन बढ़े जा रहा है, या कुछ ना कुछ हर चीज में ना फिजिकल डिजीजेस हो ही जा रही हैं, विच आर without any diagnosis, only related to stress. तो या तो ऐसे, या फिर जब आप खुद, अब ये कैसे पता चलेगा? अब ये एक रबर बैंड है, सबकी लाइफ में स्ट्रेस होता है, सबकी लाइफ में हम आए हैं तो हम सबकी लाइफ में तनाव होता है, सबकी लाइफ में स्ट्रेस होता है। अभी बच्चा स्कूल भी जाता है एग्जाम देने तो उसको थोड़ा तो एंजाइटी होती है, थोड़ी तो स्ट्रेस होती है। तो देयर इज अनहेल्दी एंजाइटी एंड देयर इज हेल्दी एंजाइटी व्हिच आल्सो पुशेस अस टू डू वेल इन लाइफ। जैसे एक रबर बैंड है, तो जब हमारे ऐसे कोई सिचुएशंस होते हैं हम उसको अपने आप को थोड़ा सा स्ट्रेच कर लेते हैं, है ना, अपने आप को स्ट्रेच कर लेते हैं, तो वो जो सर्कमस्टेंसेस और सिचुएशन है हम उसको डील कर लेते हैं और फिर वो खत्म हो जाता है। सो वी आर ओके विद इट। लेकिन जब वो रेपिटेटिवली होता रहता है, रेपिटेटिवली, जिससे आप डील नहीं कर पा रहे हैं और अंदर से आपको परेशानी हो रही है, तो वो एक स्ट्रेच रबर बैंड स्ट्रेच ही रहता है। अब ये जोन में हो गया, स्ट्रेच जोन में। अभी आपको बर्नआउट होना शुरू हो जाता है, आप कोप कर रहे हैं लेकिन अभी बर्नआउट हो रहा है, नींद नहीं आ रही, नहीं खा रहे, वेट लॉस हो रहा है, वेट गेन हो रहा है, बाल झड़ रहे हैं, D3 लेवल कम हो गया है, तो आप अभी स्ट्रेस्ड और एक बर्नआउट जोन में। और एक टाइम आता है जब ये टूट जाता है। So when you are stretching yourself over and over again, over and over again, and the same situation and circumstances is happening and you are not able to deal. कभी कभी हम क्या सोचते हैं ना, हम खुद डील कर लेते हैं, समय दे देते हैं, किसी और से पूछ लेते हैं, हो सकता है समय के साथ सब ठीक हो जाए। No, you are stretching yourself too long before the relationship snaps, before the health breaks, or before you have a mental breakdown. Please reach out for help. Please reach out. Either reach out on your own or ask somebody to take you to a therapist, get an appointment for you. So that is the stage when you should be coming and meeting a therapist.
Okay. Okay, thank you so much, Palka, for this wonderful session. There were some great pointers. I'm sure viewers will benefit from it. And it was lovely having you.
Thank you so much, the team of WHRF, for inviting me. I am very, very humbled, and this is a beautiful platform. And this is my second or my third talk, and I feel so privileged to be a part. And सारे जो आप ये topics कराते हैं, I always read through them, go through their YouTube channel. They are just so informative. So thank you for calling me on this beautiful platform and giving me to reach out to so many people through you, through your platform. I am very, very humbled.
Thank you. It was lovely having you.
Thank you.
Yeah.
Did we leave?